Over 80% of my patients who begin the aggressive nutritional supplement program I recommend really do not experience any problems. However, it is still best to take your nutritional supplementation recommendations with food, as this will allow you to absorb the nutrients they contain much better and you tolerate them better. Keep in mind that providing your body with the cellular nutrition I recommend are very potent and contain the advanced or optimal levels of supplements needed to achieve the health benefits they provide. You are going to be nourishing your body like it has never been nourished before. The body is therefore able to finally rid itself of toxins, which have been accumulating for years. Now, this is called detoxification. This is especially true in those patients who are suffering from a serious illness and are taking a significant amount of medication or are taking potent medication. Therefore, it is important to understand the possible signs and symptoms of this detoxification process so that you can deal with them confidently and properly. The most common detoxification reaction is muscle aching and possibly a mild headache. These symptoms will generally pass within 1 to 2 weeks. If these symptoms are mild to moderate and not unbearable, I recommend that you continue your program as has been prescribed or recommended. These symptoms will settle down with time and you generally have a much better response to this aggressive nutritional supplement program. However, if the reaction is severe, it may just be too much too fast. Therefore, I recommend that you discontinue your supplementation regime until your symptoms have resolved. Then begin again. Only this time use 1/4 of the recommendations for about 3 to 5 days. If you do not have any signs of detoxification or they're mild, then you can increase to 1/2 the recommended dose. Again, once you're tolerating this level, you can slowly increase the amount you are taking until you reach the recommended dose. Another possible reaction is a detox skin rash, somewhere, anywhere on the body. One of the ways the body is able to get rid of toxins is through the skin. Now, this is not an allergic reaction to the supplements, but is instead a true detoxification reaction. This rash is dry, a very mild rash, and it looks much like a mild sunburn. Patients may also experience some changes in their bowel habits. I have seen patients develop both diarrhea and constipation when adding an aggressive nutritional supplement program. This again can be a mild detox reaction. The most common GI complaint is loose stools. However, normally they are only having 1 to 3 loose stools daily. This is just another way the body is able to rid itself of toxins. This will usually resolve over the first couple of weeks after you begin your nutritional program. Again, if it's mild to moderate, I would just persist with the recommended level of supplementation. However, if it's severe, then you may want to back off and begin more slowly, as noted above, with any detox reaction. If you become constipated after you start your nutritional supplement program, you may need to consider adding some fiber to your diet, along with increased water intake. This will usually resolve the problem. Occasionally, I need to add some additional magnesium, which will help resolve the problem if increasing your fiber intake does not work. Now, a small percentage of my patients notice increased fatigue after they start their nutritional supplement program. This may be the result of what I refer to as a natural relaxation response that occurs infrequently when you combine taking your antioxidants with minerals. Now, if you experience more fatigue after starting your supplement program, it may not be due to a detox reaction, but instead this natural relaxation response. If this happens to you, I would suggest that you take all of your recommended mineral capsules at bedtime with a snack instead of during the day. This will normally resolve this problem, and you usually end up having a better quality sleep. There's also a small percentage of people, let's say around about 4% of the population, that have some intolerance to vitamin C. This can cause nausea or an upset stomach. Now, it's important to remember to take your supplements following a meal and be sure you're not drinking too much coffee to reduce this risk. Also, the vitamin C that is in the supplements I recommend comes in a buffered form called ascorbates. Not only are they more potent, but they are much better tolerated. Many of my patients who have not been able to take vitamin C before are able to tolerate this form of vitamin C. However, if you're noting a significant upset stomach after you've taken your nutritionals, I would recommend only taking one antioxidant capsule daily with your largest meal. This is a capsule that contains the vitamin C. If you're able to tolerate this level of vitamin C, then you should increase to one capsule twice daily with food. In other words, you should slowly build up to the recommended levels. Most of my patients are generally able to build up to the recommended levels with no problems. However, occasionally they're only able to take a lower dose before their nausea or upset stomach returns. If this happens, then I recommend just taking the amount you can tolerate. I'm often asked, can I take my nutritionals with my medication? To this I respond with this question: can you eat? We hope our point is made gently but clearly that nutritional supplements simply contain nutrients we get from our foods, but at levels we can no longer obtain from our foods. If you can eat with your medication, you can also take nutritional supplements. The only exception to this is for those who are taking a medication known as Coumadin or warfarin, which blocks vitamin K in the body as a way of thinning the blood. Many physicians believe that if a patient is on Coumadin, they should not be taking any vitamin K. However, recent studies show that when you take some vitamin K in supplementation, and this is the amount in the vitamin capsules I am recommending, it is actually easier to control how thin your blood gets. Also, patients who are on thyroid medication should take their medication on an empty stomach because calcium blocks the absorption of your thyroid medication. Therefore, you should not eat or take any supplements for 30 to 45 minutes after taking your thyroid medication. Some physicians tell you not to take supplements for 4 hours after you take your thyroid medication. This is really not necessary and is poor advice. If you wait 30 to 45 minutes before you take your supplements, you'll absorb your thyroid medication properly. I want to emphasize the fact that almost all my patients tolerate these optimal or advanced levels of nutritional supplementation that I'm recommending with no problems. Even if they have some problems when they first begin taking their supplements, it will quickly resolve and they begin noting the improvements in how they feel and in their health. However, I have always learned that it's best to discuss the possible problems an individual could experience by taking nutritional supplements actually before it happens. Then if they have any problems, they are not as concerned and know how to handle them better.